So in this video, I want to do a comparison of small and large hospital labs. So basically, getting to the culture, getting into the finances, and just comparing them both. I want to do that in this video, and then tie it up with some yapping session that we can have at the end. Okay, so I've worked at a small hospital. My definition of small would be like under 100 beds. And it was under 100 beds filled at the entire time that I existed within that hospital employment experience. Now, with the larger hospital beds, the way that I'm going to quantify them is saying like 300 plus beds. Some people might say something different. This is my video. These are my definitions that I'm defining here. Thank you. So basically, with a smaller hospital lab, I would assume that it was also within a community, like a smaller community, like a small towns of America. Because when I worked at this small laboratory, it was in a small town in America. The employees that worked there had their friends and family, even themselves attended that. They had their kids at the hospital. So basically, it was like the community hospital. It was very much local people up in there, to where at one point, people that come there often got named frequent flyers. So, the frequent flyers are the people who live within the community and access the hospital to get their medical needs taken care of. For instance, we had like a couple of patients, and I memorized them because their names were like easy. But I memorized them, and those frequent flyers, they had their own specific issues like sickle cell. So every time they came, I knew that, oh, that was the sickle cell patient. And they had really personalized healthcare. That's the culture within a smaller laboratory. Now, within a larger laboratory, it's very much impersonal. You get in so many different samples at so many different intervals, to where you're not really remembering who these patients are and having this impersonal or having this personal attachment to them. They're literally just a name and a birthday that you verified, and you're just running their samples. The only time they come up individually important again is if there is some type of failure on the machine, and if there is some type of abnormality within their results. So in a larger laboratory, I personally, if I had my own hospital, it wouldn't be ideal. I'll make it small. I'll make it very much specify like members only, because I need to know what's going on with my people and make sure that they're progressing to the healing process. A larger laboratory, the culture is not even like that. Now, within a smaller laboratory, we can be like, oh, we're fighting for this person to, get out the ER, fighting to different things like that. It shows that it's a big cultural difference. And I wanted to name those just few things as cultural differences within a small and a large, like, hospital laboratory. Now, the next thing that I want to go over is like finances. So when it comes to finances, of course, like, you would think bigger is better. But in reality, what I've learned is that the lab is pretty much neglected, whether it's a larger hospital or a small hospital. The money will be allocated towards making sure patients have like newer, updated, fancier beds and stuff. They'll be, like renovating one of the floors to make it like, I don't know. It doesn't matter because I'm not a part of the budgeting team, but I just want to let you guys know from a medical professional's point of view within the laboratory what makes sense and doesn't make sense. So in the laboratory, doctors aren't able to give their patients medicine. They're not able to accurately diagnose them with anything, and without basically going through the lab. So I'm very much confused why financiers are allocated to other places within the hospital and constantly neglect the machinery within the laboratory. The machines are usually so like 30, 40 years out of date. So what comes with that? Maintenance issues, processing issues. So therefore, the money that could be spent improving the laboratory and getting it up to par, you will be saving money, because once you have that system corrected, now you can actually focus on the patients and their quality of comfort and whatnot. Because now, imagine being comfortable and you're bleeding out and they can't figure out like what's going on with you. Like, imagine being comfortable and you don't know whether you're in labor or not. comfort is not the priority. I'd rather be uncomfortable and getting these test results and knowing what's going on with my body before like I have a pillow fluffed while I'm bleeding out, or I'm done ruptured my spleen but I can't get any diagnostic results back because my pillow is soft but my instruments aren't working properly from the patient's view. Now, the last thing I want to do is a comparison, like the pros and cons of both. To me, I'm a small town girly. I'm not from a small town, but I appreciate the small town, the type of cultures that it creates. You know, like, because I'm a big city girl. I was raised in Los Angeles. I was born in Houston. So, therefore, I'm from big city to big city. One of the top largest, both of them are the top largest cities in America. So, therefore, I don't have that small town girl perspective, and I'm only learning, student of life. Yeah, so basically, I'm on the small town side just because I like personalized healthcare. I like getting intimate with things. I like knowing that, hey, I'm helping this person specifically because this person is always hurt and they come here to get medical care from us, and they want us to be able to help treat them because these patients are not just familiar to me. They go and have the same nurses. The same nurses are communicating with them when they're in pain. The nurses know their personality. They know if they're lashing out or they're not feeling good because they know that usually this person is very vibrant and bubbly. So those are other clinical indicators that are associated with these patients that these nurses and other medical professionals can basically deduce by constantly having these experiences with their community. And that's what you get from a smaller laboratory. The larger laboratory, everybody's just a number. You're trying to get as many people in as you are out. Smaller laboratories, they probably do that as well, but I was able to see the more like less businessy side of the small hospital lab, and I thoroughly enjoyed it. And that's basically the route that I will go when it comes to favoritism. So I hope this gave you guys some insight to like a small hospital lab and a larger hospital lab and the different cultures that it brings, the finances that are associated with small and large laboratories, and then also just my little, I guess, spiel on why I like smaller ones better. Um, if you guys have any experiences in like a smaller hospital or a larger hospital, if you have any comparisons that you want to say, please share your story in the comments because I want to know on bedside how did you feel like in a smaller lab if you were in, I mean in a small hospital if you're in a smaller hospital? How'd you feel in a larger hospital if you were in a larger hospital? Let's yap in the comments.